One local nurse practitioner felt called to go help at the epicenter of the coronavirus pandemic, New York City. Tonight, News 13's Courtney Mims tells us how Lindsay Hetrick made a difference on the front lines.
We were watching the numbers at home about New York, and every day it was, this awful news of there's 700 deaths today, 750 deaths today, 800 deaths today, and we just kept watching the toll from at home, and it was heartbreaking. It was terrible to watch something like that happen. It just kind of broke my heart. Here I am sitting in Panama City working in a private practice, and our numbers were dwindling. Our patients didn't really want to come out, kind of thought and prayed about it and prayed about it again and prayed about it again. And I just kept feeling this nudge from a spiritual angle that said, you're needed, go.
Nurse practitioner Lindsay Hetrick left her home, her wife, and 3 children in Lynn Haven to spend 2 weeks in the epicenter of the coronavirus pandemic, working the night shift in the ICU of a Manhattan hospital.
I expected it to just be, patients in the hallways and patients in the stairwells and patients outside and just absolute chaos. And not to say it wasn't chaos when I got there, it absolutely was. But the nurses in New York were phenomenal. Everyone just kind of opened their arms and said, thank you for coming. Thank you for coming. I must have heard that 100 times a day, every day I was there.
She, part of a group of hundreds of nurses from all over the country.
None of us knew each other before any of this, but 2 a.m. every morning we would meet and eat and decompress and vent and laugh and cry. And it was an awesome little group of people.
She says the agency that put them up in the hotel were equally as caring.
They spoiled us so much. They checked on us all the time. They made sure, are you hydrated? They had therapy dogs in the hotel for us to love on and get the love tank filled up a little bit.
Even the ride to and from the hotel, they felt appreciated.
And every night when we got on the bus, to every single nurse that got on the bus, how are you, honey? Did you get sleep? I hope you have a good night. Please stay safe. And he was one of the biggest encouragers the whole time, the bus driver.
Disasters are no stranger to Lindsay.
When you're on the 3rd story of a building and the roof you think is being ripped off and all the windows are bursting in, nobody took off and ran.
She spent 5 days straight inside Gulf Coast Regional Medical Center during Hurricane Michael.
It seems like pandemics or natural disasters or high stress, healthcare workers always seem to do the same thing. I've seen in both places. Everybody just kind of comes together and you get through it, you go into survival mode.
Hurricane Michael was perhaps part of a larger plan for Lindsay. She didn't realize at the time.
It's funny, I remember saying to myself when all of that happened, if I ever have the chance to give this back to a nurse that needs to go home and take care of their families, I'll do it. I'll be there. And we're not heroes, we're just nurses and we're tired, so give us some love.
Courtney Mims, News 13, Panhandle Strong.